Sir Keir Starmer has urged Boris Johnson to hold an adult conversation with the public over coronavirus next steps as the UK risks falling behind the rest of the world on easing measures. The Labour leader wrote the Prime Minister in a fresh call for the government to plot a coherent COVID-19 exit strategy as the UK death toll surpasses 20,000. Mr. Starmer said Britons deserve an adult conversation over what they face next as European neighbours reveal plans to lift lockdown restrictions. He blasted Mr. Johnson's communication with the nation as not credible and said the government needs to plan and invest in infrastructure early. He wrote, "Simply acting as if this discussion is not happening is not credible, especially when other governments and our own devolved administrations have been able to communicate so much more. The British public have made great sacrifices to make the lockdown work. They deserve to be part of an adult conversation about what comes next. If we want to take people with us and secure their consent, this is necessary now. The coming weeks require urgent preparation and planning from the government. We have already seen the consequences of poor planning and preparation. That cannot happen again." However, Foreign Secretary Dominic Raab has refuted the calls, labeling the pandemic as a delicate and dangerous stage of the coronavirus spread. Mr. Raab, who has been deputizing for Mr. Johnson while he recovered from the virus, said the government was sticking to scientific advice on social distancing measures. He added the government would proceed cautiously with lockdown measures set until the 7th of May after they were extended for a further 3 weeks on the 16th of April. Mr. Raab also swept aside Mr. Starmer's calls for a coronavirus exit strategy. He said, "We are at a delicate and dangerous stage. We need to make sure that the next steps are sure-footed, which is why we are proceeding very cautiously and we are sticking to the scientific advice with the social distancing measures at this time, whilst doing all the Meanwhile, Scotland's First Minister Nicola Sturgeon revealed she would diverge from other parts of the UK and lift lockdown measures if needed, but stressed the decision would not be political in any way, shape or form. Speaking on BBC One's The Andrew Marr Show, she said she hasn't fully supported the UK government response to the crisis. She said, and it is an if, I am not saying that we're likely to get into this territory. The UK government took decisions that I thought were premature in terms of coming out of the lockdown. Then clearly I would want to make sure that Scotland did what I judged was best to protect the population." Earlier this week, Ms. Sturgeon published a paper setting out the Scottish Government's framework for how a lockdown could be lifted in future. In it, she urged Scots to be prepared for a new reality after lockdown as the nation sets about rebuilding, and look seriously at Elsewhere, fears are rising over the long-term health impact of NHS frontline workers. The coronavirus pandemic could leave a generation of burnt-out nurses who abandon the profession after the crisis, say academics. In light of this, researchers from the universities of Southampton and Surrey are building guidance on psychological and mental health needs of nursing staff to help them cope with the emotional drain of working on the frontline. Jill Mabon, professor of health services research and nursing at the University of Surrey, said, "If we are to avoid a generation of burnt-out nurses, their physiological, psychological and safety needs must be prioritized. Nurses injured by stress may be the last to recognize it, they are wired to look after others and not self, and they therefore need colleagues, friends and managers to remind them to think of themselves. If nursing staff are not supported during this time, there is the danger that once this is all over they will leave the profession, which will put enormous stress